My name is Dr. Njogu Maina. I'm a consultant physician and a nephrologist. A nephrologist is another name for kidney specialist. I'm the head of department, nephrology and kidney services here at Kenyatta University, Teaching, Referral and Research Hospital. It's a very important day because it's a day we use, or it is used worldwide, to raise a campaign and awareness about the importance of the kidneys in the body. Some of the functions that the kidney performs include the balance of the water in the body. The kidneys are very important detoxifier, and they are very key in removing toxins from the body. So these are very important organs in the body, and unfortunately when they are sick, then many other systems of the body can be affected, because the kidneys function is very closely regulated with the heart, with the brain, with the intestines. So the kidneys have a very close working relationship with the rest of the body. The theme for this year is kidney health for everybody, or kidney health for all, and advancing healthcare and optimal medical practice. The kidney department was founded at the inception of the hospital in 2020, and it has been 4 years of growth. As a hospital, we have grown in the kind of diagnostic equipment and tests that we are able to offer for the patients. We are able to offer the regular ultrasound, CT scan, MRI for the kidneys, and even molecular imaging for kidney diseases that are able to test the function of the kidney. The department also has been able to provide the ICU special kind of dialysis. It is called continuous renal replacement therapy. This is a very unique service that is not offered in many facilities. We are able to run a clinic for kidney sicknesses and kidney illnesses on a weekly basis. We are able to run clinics for children who are suffering from kidney diseases. We've been able to offer the special dialysis that is offered for children, that is called peritoneal dialysis. It is now available in our hospital. We are able to offer pediatric nephrology consultation services for our children, and currently we have over 30 dialysis machines, and we are able to offer dialysis to patients both as inpatients and outpatients. We are able to offer dialysis to over 100 outpatients who require dialysis as outpatients on a regular basis.
My name is Fidel Castro. I'm 29 years old. Initially at work, I had a problem with vision. After finding out that the creatinine levels were very high, I came and I was admitted. During my admission, I was told my kidneys had failed, and now they advised me to start on dialysis. Now I started dialyzing here at Kenyatta University around October last year, and the machines are good. Since we've added more machines, I'm now part of the institution, and I'm happy. We have new machines, better ones. So far, so good.
Yeah, my name is Emmanuel Gitao. I'm 41 years old. Actually, I was diagnosed with renal failure for the last 21 years. Actually, I'm the oldest in Kenya. Renal failure is a condition whereby your kidneys don't function. Kidneys are organs in the body, and actually they don't function. So you have to get support via a certain treatment called dialysis, so that any excess fluids, like personally, I don't pass any urine for the last 21 years. Actually, let's say 20 years, I've not been passing any urine. So to remove the waste and everything, I have to go for dialysis. Actually, kidney failure, according to the doctors, they usually tell us it's mostly due to diabetes or high blood pressure. For my case, it was due to hypertension. So I had a high grade, I had BP. So that's why I started my dialysis. So actually, one has to take care of his health. I usually tell people to really take care of themselves, because if you don't take medication, obviously it will go from at least to worse, because when you take medication, things will be better off. But if you don't take, it will be worse, and maybe even unable to maintain, and maybe go to such things like dialysis. So it is really important to take your medications, and also to live a healthy lifestyle, because actually nowadays people tend to, kisikia ubao na kula tu chipo na soda, we bora ushibe. It's really a very unhealthy lifestyle. Like for me, I desire to take water. As I told you, I don't urinate. I don't pass any urine. So I desire to take water, but I'm only supposed to take 2 glasses in a day. Everything has consequences, so I have to limit myself. But instead of getting to that point, you just do what is supposed to be done. Yeah, actually NHIF pays for our dialysis. Per session is 9,500. So per week, twice dialysis, actually it's 19,000 NHIF pays. Actually KU referral was like a God-sent place, because one, it's very close to my home. Actually, it's just 12 minutes drive. You can imagine I pay to urinate. I go like kilometers to urinate. For Karen used to go like 40 plus kilometers. Here, it's only a 12-minute drive. So niko hapa kwa sababu it is the best place to be. Actually, if at all this place was not, up to the standards, I will not be here. So I love this place because one, the environment, so nice. Actually, it is very accommodating. When you go elsewhere, it's when you get to know this is a very wonderful place. And also the doctors. Actually, we have very good doctors. Renal, it's like a second home, because every twice in a week I have to be here, maybe thrice in a week, depending on how many days you dialyze. Actually, it's a long journey, but with faith, you get to move on, because you have to live. Everyone has his or her own challenges, like you have your own. Actually, I cannot even be able to handle yours, but I'm able to handle mine. So I thank God for that.
So it is very imperative for these people to keep a regular clinics, and during those clinics, they can be performing regular kidney tests. And if problems are detected, then they can be addressed early by being given the right and the best medication for those conditions. Number 2, it is very important for patients and people to keep and obey and adhere to the prescriptions that are given by their doctors and healthcare providers. Number 3, the people need to take the medications whether they are feeling well or they are feeling unwell. What we have noticed a lot in our clinics is that people come to the hospital and they are very motivated when they have the symptoms or they are very sick. But when the symptoms resolve, we realize many people start dropping out of the clinics. Others start dropping out of taking certain medications. Some of these medications are effective when they are taken for a long time. So when your doctor is prescribing the medication, they are looking at your kidney health, not only today, but maybe in the next 5 years, 10 years, or 20 years. It is very important to know that these medications can have an effect on the regular medication somebody is taking, either for cancer, for kidney disease, for hypertension, for diabetes. These alternative medications can, one, reduce the effect of the regular medications that the patients were taking, meaning they are now underdosed, or they could even increase the effect of the regular medication, prescription medication somebody was taking, meaning it's like they're having an overdose of the medication. So it is important for people to know and appreciate that before they combine the two medications, it is important to discuss with your doctor. Let them know that you're already taking this herbal medication or over-the-counter medication. Discuss with your doctor if it is safe to take those medications, and seek their advice on if you want to take them, what may be the best way to approach it. Many times kidney disease does not have symptoms until it is advanced or moderately advanced. So my emphasis is especially for people who are suffering from diabetes, hypertension, HIV/AIDS, heart conditions, cancer, and people who are above 50 years of age. It is very important for those people to have regular screening for kidney diseases so that the problems can be detected early, and some of the medical therapies that we are discussing today, they can be beneficial to them very early in the process of the kidney disease.